Welcome, everyone. I'm Dr. John Whyte, and I'm the Chief Medical Officer at WebMD. And you're watching Your Health on Tech. I bet you've used virtual reality, maybe at a birthday party, maybe in some type of sporting event. But what if I told you it can and will play a significant role in your health and healthcare? My guest today says now is the time. I'm delighted to be joined by Josh Sackman. He's the president and co-founder of AppliedVR. Josh, thanks for taking time today.
Thanks for inviting me here. I'm excited for the conversation.
Josh, I feel like in many ways we've all have heard of VR. We've tried it here and there, but when it comes to health and healthcare, it's kind of been on the fringe. But you feel that's going to change. Why is that?
I'll take you back to my first experience with VR because I think it's important to understand why we're talking about VR in healthcare. When I got introduced to virtual reality back in 2014, I was given this experience that we since recreated and called the ledge. And the premise is this. You put on a VR headset, you look around, you're in the middle of a city, you look down, you're in a window washing scaffold, and we bring you up 500 feet up the side of a building. The railing drops, and you're given one simple task: to take one confident step 500 feet into the virtual air. And as rational human beings, we should have no problem taking that virtual leap into the thin air. But because our brains haven't really evolved to separate virtual from real, the heart starts racing. Every fiber of your being says, don't take this step because I think I know where I really am, but if I'm not, there are major consequences. And this feeling is called presence. This feeling that you're actually transported somewhere else, and it connects at a deep emotional, non-conscious level. And so if you can transport people to other places and create deep, authentic emotional connections, think of all the powerful things that you could do with that.
And you're bringing it back to health, particularly chronic pain. And I'm fascinated by a quote that I saw you gave recently, and I want to read it back to you, if I may. And you say, we have an outdated chronic pain care model. It's over-reliance on pharmaceuticals, and that people don't like pills. People don't like injections. And we need to make treatment an enjoyable experience. Tell us more what you mean by that.
I grew up with chronic pain. I had a congenital ligament issue that led to dislocated shoulders and torn meniscus and repeated procedures and recoveries. And there was not a single part of that recovery that was in any way enjoyable. And it wasn't until I developed psychological coping skills and ability to self-regulate through experiences with psychologists and physical therapists and all these other professionals that taught me outside of the medical interventions, which were absolutely necessary and a key part of my recovery. But I learned that the brain, the mind, the body, it's so powerful when you learn to use it as a tool in your favor instead of resist against a lot of these things that we often struggle with. And IASP, the International Association for the Study of Pain, has since relabeled pain as not just a sensory experience, but as an emotional experience. And for those of us who have suffered with pain, mental health, or pretty much any type of illness, we know that our social construct, where we are, who we're surrounded by, play a really important role in how we experience our condition. And you don't have to wait, in many cases, 6 months to see a pain specialist, but you can put on a headset when you need it in the comfort of your own home. This unlocks a whole new potential for what healthcare looks like.
But what do you say to the cynics who are listening now? How can this help with high blood pressure? Could it help with hyperlipidemia? Maybe I could see how it could help with anxiety. What's your response to them? Because you're conducting scientific studies around these issues.
That's right. Skepticism is so important and instrumental in healthcare. But ultimately, it comes down to we wanted virtual reality as a modality of treatment, and we wanted this to be accessible, just like any other drug or medical device. And so what does that look like? Doctor prescribed, insurance reimbursed, integrated into guidelines for how doctors think about treating patients. And so we took that as our future state. That's where we wanted our ideal future to look like. So we're still not quite there, but we are building a pathway to legitimize this medicine. And that has to be done in other
Sure.
therapeutic areas as well.
Now, it becomes complicated because you have the patient that you have to convince, but you also have to convince the doctor or, the provider. And I'm a physician. We tend to be skeptic, right? We're used to saying, take a pill, do an injection, the exact things you referenced. How do you get the provider community on board, even if this works that you show in your studies?
Excellent point. It really starts with the physician. That is where that trusted relationship with the patient sits. He or she is absolutely necessary and required for patients to have access to this. And so we've been really thoughtful in understanding a willingness and readiness to adopt. And not every physician is going to be an early adopter. But many physicians are looking at, especially in the pain management specialty, how to create some version of multidisciplinary pain clinic, because that model is very well established and studied as being very helpful to the patient. It's not the same as seeing a pain psychologist, but we can offer some of the benefits of learning psychology-based skills. And so some of the early adopters we've been working with have been really receptive because it helps them broaden their toolkit for how they can support their patients.
One thing I want to go back to that might be confusing to our audience is that you pointed out this is going to need a prescription. It's not just you're putting on a headset and then you're going to feel better. Well, what does that look like? What will the prescriber write?
Right now, our device, RelieveRx, is indicated for chronic low back pain. We're in the midst of discussions with the FDA and looking at the clinical pathway to expand that. Because ultimately, what we developed is a program that develops self-regulatory tools and psychological coping skills to help deal with chronic pain. And while it's not specific to back pain, that is the study population in our clinical trials that we looked at. And so we help physicians identify patients that meet the criteria that's consistent with their FDA label, as well as some other factors that are indicators that patients are going to be compliant and engaged with treatment. Because this is a behavioral therapy. This is something that requires active participation. So patients receive a headset into the home and they go through a module, which on average is about 6 to 7 minutes per day, every day for 8 weeks. And it's all rooted in evidence-based principles to teach the self-management of chronic pain. While patients do feel relaxed in the middle of a session and after a couple of sessions, it can take a couple of weeks to actually reach the clinically meaningful thresholds for the reductions in pain. So that's also a novel concept with patients that requires some expectation setting and dialogue between the physician and the patient, both in terms of what actions need to be taken to get the therapeutic benefits and what to expect as a patient progresses through the program.
And Josh, this therapy can be used in addition to other therapies. It doesn't have to be competitive to them, correct?
Correct. This is an adjunctive treatment. And what's really nice about
Yeah.
immersive therapeutics is it plays really nicely with other types of therapies. There aren't necessarily side effects in the same degree that a drug or medical device would, though some patients may find the headset uncomfortable or have some transient dizziness. There's a low interference profile, so it's not like certain drugs can't be taken together. And what's really important to emphasize is it's not one size fits all. As someone who experienced chronic pain, what worked for me doesn't necessarily work for other types of patients. And so what we're trying to do is arm a toolkit of safe and effective, validated treatments that physicians could put into their toolkit to be able to offer patients a different configuration of tools that may work for them.
Well, how can physicians learn more about this potential treatment option? And how can patients learn more as well?
To learn more, you can visit AppliedVR.io. We have a number of our publications, as well as marketing material, as well as contact forms. Or if you're a patient, I encourage you to talk to your physician.
Well, Josh, thanks for taking the time today to tell us about this exciting innovation.
Thank you so much. I really enjoyed the conversation.